Well, it's not just the provinces going over Ottawa's proposed funding plan for healthcare. Several health groups right across the country are also looking very closely at the proposal, and that includes HealthCareCAN, the national voice for healthcare associations and hospitals across the country. Dr. Michael Gardam chairs the organization's board of directors. He joins us right now. Dr. Gardam, good to see you again.
Yeah, thanks for having me.
Now, there was a lot of talk about transforming Canada's healthcare system before yesterday's meeting of the First Ministers. But the proposal, when you look at the dollar figures, is a lot less than what the provinces were asking for, $4.6 billion annually versus $28 billion. Did the federal government miss its chance to help transform healthcare?
It's an interesting question. I mean, we're the first ones to say that throwing, an infinite amount of money into Canadian healthcare the way it is probably money not well spent. We do think that certainly the situation we're in post-pandemic, now that we're 3 years into this, we definitely need some help with funding, but we truly need to get into transforming our healthcare system. And that's a little bit less about money and more about the provinces taking on the really hard questions about, what should our healthcare system look like going into the future? We've had pretty much the same system now going on, since Medicare was created. And our system is not performing well compared to other countries.
It's interesting you say that because that is essentially the arguments that we're hearing from government members right now. And when you look at this deal, immediately you're looking at a $2 billion top-up that comes with no strings attached. Then there are these annual increases and side deals if the provinces say yes. So let's break that up, if you don't mind, beginning with the $2 billion. Where do you see that money helping out the most?
Yeah, well, I think every province will be different, and that's one of the things that probably the provinces like about this. We're not all the same, so, here in my province, we have a number of serious challenges with health staffing. So anything that we could put that money towards being able to recruit more people here would be a real bonus for us. We're having a huge push into reforming primary care, seniors care, home care. The reality is that there's really no part of healthcare here on the island that I couldn't use money for. So we will have no problem spending whatever our share of that is. I think to me, the more interesting part is the money coming later, which has some strings attached. HealthCareCAN's very supportive of having some strings attached because honestly, you can't just keep throwing money into a system if it's not going to be nudged into a better direction. And so hopefully those accountability agreements will give some measure of that to allow us to start to focus on, key things that we need to focus on.
Okay, give some measure, but really what can Ottawa do if it's not anteing up more money to the table?
Well, that's it. And that's why it always comes down to, the premiers can argue all they want that the feds aren't giving them enough money. But the reality is, the provinces are very clear that healthcare is in their authority. The healthcare is owned by the provinces. To me and to HealthCareCAN, what that means is they also own the transformation of healthcare. So you're right, the feds can't do a whole lot here. And we've seen that for decades. They can give more money, they can sort of attach some stipulations to it. But ultimately, to get the healthcare system that Canadians want, all 13 of our Canadian healthcare systems are going to have to figure out what that looks like going forward. And the feds can't be all that much help with that, except to say, follow the Canada Health Act. It has to be, we have to be able to care for each other in different provinces and territories, et cetera. But we've spent a long time pointing fingers at different levels of government, but the reality is, I think HealthCareCAN feels strongly that the provinces need to step up at this point and figure out what the future looks like.
Do you think that includes more privatization? Because for many, that is a red line to cross. Although a recent poll just published earlier this week says now a majority of Canadians are willing to look at more private health care because they're just sick of not having care.
Personally, I think we feel that everything should be on the table, and that doesn't mean that, we're for or against privatization, but I think to just say no to something isn't helpful. We should look at, is this going to help serve Canadians? Is it going to save costs while providing better care? then maybe we should look at it. I think the other thing that often Canadians don't realize is we have roughly the same proportion of private care already in our system compared to the United States. So all those fee-for-service doctors are private operators. The pharmacists are private operators. When you go to get your eyes checked, those are private operators. And so we have roughly the same proportion. And so really, we're just talking about really thinking about where could other private operators potentially give us better service. Because ultimately, in my mind, it shouldn't be about whether it's private or public. It should be about, are we serving Canadians and can we provide better service for Canadians? Not for the elite, right? We're not talking about that kind of system. But is there a way that we can potentially provide better service for all Canadians?
Dr. Michael Gardam, things to think about. Really appreciate your thoughts tonight.
Thanks for having me.
Thank you.